Welcome to The Explainer. We trust them with our lives, but have you ever stopped to think about how the medications we take actually work? Today, we're pulling back the curtain on the incredible science and the critical safety checks that turn a simple pill into a powerful tool for healing. And, importantly, we'll talk about your role in making sure it all goes right.
So let's start this off not with a boring textbook definition, but with a real-world, heart-pounding moment that could happen in any hospital on any given day.
Just imagine you're a nurse caring for a patient. We'll call him Francois Baptiste. You go to give him his medication, and this thought hits you. You're holding the correct medication. The dose is absolutely perfect, but the label has someone else's name on it. Everything is right, except for the one detail that changes everything.
In healthcare, this is what they call a near miss. Phew! A potential error was caught just in the nick of time. So how in the world does a mix-up like this even happen? And maybe more importantly, what systems are in place that are supposed to prevent these near misses from becoming actual tragic accidents?
To really get a handle on those safety systems, we first have to understand the science. What does a medication actually do once it enters your body? It's a pretty fascinating and complex journey, let me tell you.
The whole science that covers this is called pharmacology. It's the entire field dedicated to figuring out how different substances can change how our bodies work. And this science is really neatly split into two key areas that explain the intricate dance between your body and a medication.
The best way to think about this is like a two-way street. On one side, you have pharmacokinetics. That's everything your body does to the drug. And on the other side, you have pharmacodynamics, which is what the drug does to your body. Let's follow that journey, step by step.
So, the whole journey kicks off with absorption. This is the drug's entry point. Whether you swallow a pill, put on a cream, or get a shot, the medication's very first job is to get from that starting point into your bloodstream so it can get moving.
Once it's in the bloodstream, it is time for distribution. Think of your circulatory system as a super high-speed delivery service. It carries those drug molecules all through your body to the specific tissues and organs where they're needed to, work their magic.
Next up, the medication arrives at the body's main processing plant, the liver. This is metabolism. It's where the drug gets broken down, changed, and basically prepared for use and eventually removal. It's a totally critical step that deactivates the drug after it's done its job.
And finally, excretion. Your kidneys are the ultimate filtration system. They take the metabolized drug byproducts out of the blood and get rid of them, usually in your urine. And that completes the whole cycle of what the body does to the drug.
So if all that was the journey, pharmacodynamics is the destination. This is the action part. The drug molecule acts like a really specific key. It finds and binds to a perfectly matching receptor on a cell, that's the lock, and it turns, triggering a very specific response. Maybe that's relieving pain, or lowering blood pressure, or fighting off an infection.
Okay, so now that we've got the science down, let's circle all the way back to our opening story about Francois Baptiste. Let's look at the powerful, yet surprisingly simple, safety systems that turned a potential disaster into just a learning moment. The very first line of defense is this simple automatic habit called the 3 checks. Every single time a nurse touches a medication, they're trained to read the label 3 separate times. Once when they grab it, again right before they prepare it, and one final time right at the patient's bedside.
And these checks are guided by a really important checklist. The rights of medication administration. Is this the right patient? Is it the right drug? The right dose? It's a systematic process to make sure every single critical detail is correct before anything is given.
And this is exactly why these procedures are so incredibly important. The nurse in Francois Baptiste's story was just following the process, and during one of those final checks, they caught it, the wrong patient name. The system worked. A human safety net caught the error before it could cause any harm at all.
Now these hospital procedures, they didn't just show up out of nowhere. They're actually built on a foundation of more than 100 years of laws. From making sure a drug is what it says it is, to requiring serious safety testing and clear labels, these laws created the safe pharmaceutical world that we, frankly, often take for granted.
But here's the thing. Safety isn't just about giving the right drug to the right person. Even when everything is done perfectly, the effects of a medication can be wildly different from one person to the next. So, why is that?
I bet this sounds familiar. It's a question doctors and nurses hear constantly. A patient, let's call her Mildred Campbell, sees a really convincing TV ad for a new arthritis drug, and she wonders, hey, is that right for me? It seems like a simple question, right? But the answer is actually incredibly complex.
So can she just start taking it? The very quick answer is a definite no. Because what works like a miracle for the actors in a commercial or even for a friend could be totally useless or, even worse, dangerous for Mildred.
And that's because there are so many things that make you, well, you. Your age, your weight, your genetics, other health conditions, they all change how your body handles a drug. And a really big one, especially for older adults, is something called polypharmacy. That's just a fancy word for taking multiple medications at once, which can create a whole cocktail of risky interactions.
So we've talked about all these robust safety nets that the healthcare system has, but the final, and I would argue the most important, piece of the medication safety puzzle is you.
There's this one key process where you play an absolutely vital role. It's called medication reconciliation. This usually happens during big transitions, like when you're being admitted to a hospital or getting ready to go home. The medical team sits down and compares the list of medications you're actually taking with what they want to order, all to prevent duplications or harmful interactions. Your accurate input here is everything.
So here it is. This is your personal safety playbook. First, keep a current, accurate list of every single thing you take. And yes, that includes vitamins and supplements. Second, know what each drug is for. And third, and this is so important, always ask questions. If a pill looks different or if you're just not sure about something, speak up. You are the world's leading expert on you.
At the end of the day, the complex world of medication has countless safeguards in place. But the whole system works best when its most important member, you, is engaged and informed. By asking questions and staying involved, you stop being just a passive patient and become an active partner. And that partnership helps your entire healthcare team keep you as safe and as healthy as possible.